Okay, so a burn is a wound or an ulcer due to an external agent causing coagulative necrosis. Now, when we talk about these external agent, okay, this when we're talking about external agent, this is where we're now going to talk about the causes. What are the causes of burns? Okay, the causes of burns. Number one, we have what are called extremes of temperature. Extremes of what? Temperature. Now, in other words, when we say extremes of temperature, remember when we say the word extreme, it simply means either way too high or way too lower than normal, isn't it? That's what it means when we say extreme. Way too high or way too lower than normal. Even in this case, we can have those burns that are caused by very high temperatures and those burns that are caused by very low temperatures. Okay, so it's very possible to have burns being caused by very low temperatures. For example, if you get ice, okay, very cold ice, you put it in on your skin, you're going to find that it can cause burns. Okay, it can cause burns. So we can say A, we have very high temperatures. Okay, very high temperatures. Okay, and B, we can have very low temperatures. Okay, now when we talk about very high temperatures, right? When we talk about very high temperatures causing burns, okay, we have these are what are called thermal burns. Okay, thermal burns. Okay, very high temperatures cause what are called thermal burns, while very low temperatures cause what are called frost burns. Okay, thermal burns and frost burns, that is the name that is given to that. Now, on this, for example, on thermal burns, you can have, let's say, for example, you can have flames. Okay, you can have flames or fire. You can also have things like hot liquids. Okay, hot liquids. You can also have things like vapor. Okay, hot vapor. Right. So these are some of the causes of what? Of these thermal burns. Okay. Then of course we also have the frost burns due to very low temperatures. Okay. Very low temperatures. Now, other than extremes of temperature, we can also have what are called chemical burns. All right. We can have chemical burns. Is there any question maybe before I proceed? So we've defined burns that they are wounds due to they are wounds due to what? An external agent, okay, which cause coagulative necrosis of the tissue, okay, of the tissue. Then we are now looking at that external agent where we are calling them what? The causes of burns. Number one, we talked about extremes of temperature where we're saying that we have what? We have very high temperatures where we have thermal burns and very low temperatures which cause frost burns. Okay. Then number two we have chemical burns. Okay. Chemical burns, mostly here we have acids and alkalis. Okay. So remember all of them, all these are corrosive. Okay. They are all corrosive. Right. So since they are all corrosive, it means that when they come into contact with the body, with any part of the body, it means that they are going to cause burns called chemical burns. Now, of the two, between acids and alkalis, we should know that alkalis are more dangerous. Okay? They are more dangerous. And the reason is that the body has mechanisms of counteracting acids. Okay, they have a buffer system. So we're saying that as the body has buffer systems, okay, to counteract the effect of acids and not alkalis. Okay. So what we find is that because the body has these buffer systems that counteract the effect of acids and not alkalis, it means that once, if it is the alkali that is involved, it is going to have much more effect compared to the acids. Okay. For example, in the body you find all these things like the bicarbonate ions and so on. Okay. There are many. Okay. There are more alkalis. Okay. Than in the body than the acid, or rather, there are more buffer systems that work against the effect of acids than buffer systems that work against the effect of what? Of alkalis. So because of that imbalance, you find that alkalis tend to have much more effect. If an acid can go this far in causing these burns, the alkali will go much further in causing the burns. Okay. So we've talked about alkalis, these chemical burns, and then we can also talk about what friction. Okay, friction. I remember those days. If I told you guys also used to play like that, where you go on some sort of a rock, like those sort of hills, and then if it's kind of maybe at least smooth or something, and then you're sliding there. You sit there and then you slide from top to the bottom of that hill, or maybe an inch or something. Or maybe, for example, if you fall, right? You fall and then you find yourself sliding. There's going to be that contact between your skin and the hard surface, which is the ground in this case. So you're going to find that it's going to cause that friction. There's going to be those burns due to the friction. Okay. So number 3 cause of burns is what? It's friction. Okay, friction. Then number 4, the other thing that can cause burns is electricity, or rather what are called electrical burns. Okay, so electrical burns here, this is something that we should understand. Okay, in the body we have neurons. Okay, we have neurons and muscle, right? And muscle. Now, remember, both of these, they are electrical conductors. They are good conductors of electricity. Remember what it means when we say good conductor and bad conductor. When we say good conductor, it means that it conducts, or rather it allows electricity to pass through. Okay? And then bad conductor, it means that that particular substance, or rather that particular material, does not allow electricity to actually pass through. Now, when you look at neurons actually, they have low resistance. Okay, they have low resistance compared to the muscle. These ones have high resistance. Okay. Now, what happens is this. Imagine this is a neuron. Imagine this is a neuron here. Okay, and then at the end we have these muscle fibers as well. We have these muscle fibers. Okay. So what is happening is that here there is low resistance. Here there is high resistance. Okay, there is high resistance. So what will happen is this: as electricity is traveling through the neuron, and then as it is about to go, due to that difference or rather due to that transition from the neuron into the muscle, which is of high resistance, there is going to be production. Remember, Let me give an example. When you look at a light bulb, right? When you look at a light bulb, you have that filament inside the light bulb, okay? And that filament, the reason why that filament is made of, mostly is made of tungsten. And the reason why it is made of tungsten is because, number one, tungsten has very high resistance and it has a high melting point. Now, on the resistance part, when a particular wire, let's talk about a wire, when a wire has high resistance, there is tendency of part of that current or that electrical energy being converted to what? To heat energy, right? So what is happening is that because of that resistance, so some of the electrical energy in this case cannot pass through the what? It cannot pass through the muscle. So where is the extra energy going to go? Because we know that energy is neither destroyed or created. It is only transformed from one form to another. So in a case where this electrical energy is passing through the neuron and then reaches the neuronal muscular junction, and then there is high resistance. So some of the electrical energy is going to will not be able to pass through the muscle. And because of that, what is going to happen is that the extra electrical energy is going to be converted to what? To heat energy. And that is what is going to cause the burns on the skin, okay? Which is going to manifest on the skin or on any other part of the body. Okay, so that is basically what happens with the electrical burns. Electrical energy is passing through a low resistance neuron and then reaches a neuronal muscular junction, and then in the muscle we know that there is a high resistance, so the extra energy which cannot pass through the muscle is going to be converted to what? To heat energy, which is going to cause the burns. Okay, so that is basically what happens in the case of electrical burns. Now, what are these? How can we classify them? Okay, so we can have artificial or natural causes. Okay, so we have artificial and natural. Now, what are the natural causes of electrical burns? You know about lightning? Okay, lightning, that is simply electricity. If you remember from your grade 12, should be grade 12, you looked at what is called static electricity. So that is why you also look at things like lightning. So lightning is a natural cause, except in Luapula. It's not natural. It's created actually. Do I have anyone from Luapula here? People can beat you. Anyone from Luapula? Okay. So I was saying that the natural cause of electrical burns, we have lightning, and then on artificial we can have domestic. Okay, we have domestic and industrial. Okay, so these ones, the domestic one is in low voltage. Then the industrial one is in high voltage. So most of the times when someone is electrocuted at home in the house, you find that it's very easy to survive. Okay, it's easier to survive when someone is electrocuted just in the house because the voltage in the house is quite low. But the voltage in industries, okay, the voltage in industries, when you go and touch the transformer, those naked wires and whatever, you will not survive because it is in high voltage. Okay, but that most of them are 11 kg, kV, 22 kV, whatever, all those. Okay, so it's a lot of energy, and it's possible that someone can even die almost instantly. Okay, so that is about the causes of burns. Now, when you receive a patient with burns, what are you supposed to do? Okay, what are you supposed to do when you receive a patient with burns? Okay, so let's go ahead and look at what to do when you receive a patient with burns. Any question before I proceed? Is there any question? Okay, is it clear? Is it clear? Thank you very much. Mm-hmm. Sure. Okay, I guess I'll be able to touch that part as we proceed. Is that okay? Okay. All right. So let's look at what to do when. So on your history, okay, you need to take history when a patient comes. All right. So on demographics, okay, on demographics, it's very, very important for you to know the age and weight. Okay, for someone with burns, especially children, you need to know, you need to ask the age and what weight of the patient. Okay, the weight, the age and weight of the patient. Then number two, you also need to know the time. Okay, the time when it happened. All right, and the time lapse. The time lapse to presentation. Okay, and the time lapse to what? To presentation. Now, this is very, very important. Okay, very important. These two things that I've mentioned are very important because weight, with weight, you're going, this is what is going to help you calculate. Okay, calculate. It's going to help you calculate what? Fluids, the amount of fluids to give. Okay, and then on time lapse, yeah, this is going to help you. Okay, this is presentation, not what did I write? Presentation. Okay, so the time lapse is going to help you to know, okay, when to initiate fluids. Okay, so we're going to talk about that as we proceed, right? We're going to talk about it now. Um, the other thing that we need to look at, okay, the other thing that you need to ask is the cause of burns. Now, by the way, obviously, if issues of first aid comes in, okay, if issues of first aid were to come in, where, for example, you are directly witnessing someone that is getting burnt. So number one thing that you need to do is to stop the burning process. Okay, someone is exposed to a source of heat, you remove them or you remove the source of heat. Okay, you extinguish the fire, whatever you can do, so that you discontinue the burning process. Okay, the other thing that you obviously need to do is to do the ABCs before you even start taking the history, or as you are taking this your history, you can do the ABCs. Remember, we already discussed what? We already discussed what is called the ATOS protocol, isn't it? So you need to apply that. So you manage burns patients the same way you manage trauma patients, because this is also trauma. Okay, I think let me make that clear from the word go. When you receive a burns patient, manage them the same way you manage a trauma patient. Okay, start with obviously the primary survey. You do your ABCs, okay, and so on, and then you go ahead. As you are doing that, you also take that history within the shortest period of time. Okay, so we're talking about, I was saying that one, you find out the age and the weight of the patient, the time when it happened, and time lapse to presentation. From the time it happened, from the time the patient got bent, up to time of presentation, how much time has passed? Okay, how much time has passed? And I'm going to explain why that is important to find out. Then the cause of burns, is it thermal burns, is it frost burns, is it electrical burns, is it what? Whatever it is, you need to know what caused the burns. Number 4, the other thing that you need to know is past medical history. Okay, on your past medical history, what is very important on past medical history in this case is history, if there's any history of convulsive disorder. Okay, why are we talking about convulsive disorder? Imagine the way it is winter, it is July, right? And then you are trying to warm yourself. Okay, you're trying to warm yourself, and you're seated, or maybe this child is seated near a brazier or whatever source of heat, but this child has a convulsive disorder, let's say has epilepsy, and then while trying to warm themselves, they start having convulsions right there and then what happens? They get burnt, okay? Or maybe they're seated next to a pot of boiling water or whatever, and then they hit that pot and they get burnt, okay? So if there's any history of convulsive disorder, you'll be able to know, and you'll be able to manage that as well, so that a similar occurrence does not occur again, okay? The other thing is on social history, and this is very important, especially for child support. Number 5, social history. Okay, social history. You need to look out for evidence of neglect or child abuse, okay, or parents with disability. So now let me explain this. Imagine this is very common. It's very, very, very common. Okay, where this child, the parents are left, maybe both parents, and then maybe living with maybe an aunt, or maybe the mother is left living with a stepmother, or any such circumstances. These are very, very common circumstances. Okay, and then we know what usually happens, not always, but it's very common, like I mentioned. If that child is living with someone who's not a biological parent, in most cases, in a good number of cases, they get to be abused, they get to be neglected. A child is small, but they're neglected, they are on their own, or they're being abused. Okay, it's a small child being told to go and get hot water from a heat source, whatever, and so on. And the child, in the end, gets bent. Okay, in other cases, as a way of punishment, okay, as a way of punishment as well, some of these step parents, they do apply a source of heat on the child's body. Okay, omwana bamwocha, apya omwana kumwocha bamwocha. It happens. Okay, so you need to look out for that. Why are you doing that? It's because, remember, in your second year, you looked at what is called the biopsychosocial model of, which is like where you want to approach in all angles as you offer therapy to these patients. Okay, so after you treat the patient, you don't want the patient to go to the same environment where they will still be exposed to similar incidences. Okay, so after you treat your patient, you have to make sure that where they are going itself and a similar thing is not going to happen. That's why you are asking about the issue of neglect or child what abuse, or their parents with disability. Okay, it could be maybe a parent has this what excuse me, the parent has a disability, maybe whatever disability the parent may have, and they're not able to take care of the child properly. Okay, so you need to support that family and see how the child can be helped. Okay, so those are some of the things that are very important for you to note. Okay, then other than that, the sixth thing that you need to do, so this is on history. Okay, the other thing that you need to do is to estimate the degree of the burns. Now, last time when the other day when I was supposed to teach you these things, I requested you to revise the anatomy of the skin, specifically the layers of the skin, right? So, is there anyone who would want to tell us the layers of the skin? Anyone? Come on, guys. What's your problem? Let's talk. Okay. Okay. Anyone else? Anyone else wants to tell us the layers of the skin? You guys, you are all mute. Okay, go ahead. Okay. Mm-hmm. Mm-hmm. Okay. Mm-hmm. 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 Okay. Mm-hmm. Mm-hmm. Okay. So what I really wanted to hear is these layers. We have the first layer of the skin is the epidermis. Okay. The epidermis. Of course, it has several other layers, which are about five. And then we have something like that. Okay, so this is the epidermis, and then this is the dermis. The dermis. So we have the reticular dermis, and what? What is the other one that you mentioned? Reticular dermis and what? The papillary dermis. Okay, the papillary dermis is the one on top, right? Okay, I think I've. So I have papillary dermis and reticular dermis. Okay. And then we have the hypodermis. Hypodermis, which is simply what? Subcutaneous tissue. Okay, subcutaneous tissue. And then after that, that's why we have muscle. Okay, we're going to have muscle, right? After that, we're going to have things like muscle, and then bone, and so on. Okay, now, so when there is a burn, whenever there are burns, these burns can affect from top to bottom like that. Okay, so this is what now we talk about the grading of burns. Okay, so we have first degree, second degree, third degree, and fourth degree burns. Okay, first degree, second degree, third degree, and fourth degree burns. So you have to inspect the burns and know which degree are they. Okay, so now we have first degree when it is only going up to the epidermis, that is what? First degree, okay? Or what is called the superficial burns, right? Superficial burns, okay? And then up to the dermis, we have what is called the second degree burns, where we can have superficial, partial thickness, okay? Partial thickness, and if it is involving also the reticular dermis, it is called the partial thickness burns. Okay, the partial thickness burns. Now, I want to mention this. I want to mention this. In other literatures, you'll find that when it goes up to the dermis, sometimes it will just be called what? The superficial partial thickness burns. Okay, then up to the hypodermis. Okay, if it is involving the subcutaneous tissue, this is third degree, and this is called full thickness. Okay, full thickness burns. And then we have fourth degree, which is going up to muscle or bone. So if burns go up to muscle or bone, this is called what? Fourth degree. If it goes up to the subcutaneous tissue, this is third degree, or what is called what? Full thickness burns. Then second degree burns, which can either be superficial partial thickness or superficial, or what are called partial thickness. We can, if it is going up to the reticular dermis. Then first degree, this is why it is only involving what? The epidermis. Okay. Now, when you look at these superficial burns, specifically the superficial burns, first degree, this is where we have things such as sunburns. Okay. You know how, especially in the Caucasians, okay, the Caucasians, when they go to an area where there is a lot of heat, you find that their skin will become erythematous, isn't it? It will become erythematous, okay? So such things, such are called what? Superficial burns. Okay, they are called superficial burns or first degree burns. Then even in our setup, we find that if the heat is not too much, it doesn't cause much injury, then your skin only becomes erythematous. This is basically what is called the first degree burns. Then in second degree burns, this is where you're going to find blisters. Most of the times you find blisters. Okay, you're going to find blisters, right? And then in the case of full thickness, these are going to appear reddish. Okay, they appear reddish. So the skin, there's no skin, there's no what. Then you're going to find that it's going to be red. And then these ones, they are usually gray. Okay, they are usually grayish in color because of the myoglobin being produced. Okay, so now, what am I saying? What are we saying? Okay, when it goes up to when you look at third degree, or rather the full thickness burns, these are painless. Now, I want you to get me clearly here. The full thickness burns up to where, if it goes up to muscle, they are usually painless. Now, this is the trick. Two patients present with burns. One is crying on the top of their voice because of the pain. Okay, they are crying. The other one is not even crying at all. Okay, because according to them, it's not painful. Which of the two patients would you attend to first? Which of the two patients would you rather attend to first? Is it the one that is, okay, according to triad? Yes, exactly. Okay, so the one that is quiet is the one that is much in danger. Specifically in this case, when you're talking about burns, is because Remember, the pain fibers are somewhere in the reticular dermis. That's why you find the nerve endings attached to the what? To the dermis. So if the veins go all the way up to, up to the subcutaneous tissue, all the way up to there, it means that the nerve endings, they have all been destroyed, and because of that you are not able to sense any pain. You cannot feel any pain. Okay, so someone who has foot thickness burns is not feeling any pain at that area because the nerve endings have been destroyed. Okay, so if you go by the screaming, whatever, you're going to actually kill the one that is quiet. Okay, is it okay? Is it clear? Perfect. Okay, now the other thing that we need to look at is we have to look at what is called, can I erase this? So that is about grading of bends. Okay, that is about grading of bends. Let me end this video here.